Hey, Dave O'Sullivan here, international sports physio, private practice owner, and I've also been fortunate to mentor over 1,000 therapists now all over the world, helping them become go-to physios. And I also help go-to clinic owners break free from constantly worrying about having to find new patients, maximizing the patients that they have in the clinic's diary, ethically keeping those patients progressing so that you can build a go-to clinic that gives you true freedom. Now, in this video, I want to talk about the 6 stages of the patient journey. So the go-to clinic 6 stages is a critical piece of methodology that we use to help clinic owners have clinicians that can self-manage. So whether you're a private practice therapist working for someone else in private practice, or you're a clinic owner, you or your therapist can use these 6 stages to figure out very quickly where patients are dropping off. And the beauty of the 6 stages is the stage that the patient passes is an output, and there's specific inputs or key actions that we need to take that leads to those outputs. So if we know the stage that the patient hasn't progressed through, then we can easily tell what are the inputs that we need to do to fix those issues. So what are the 6 stages of the go-to clinic patient journey? Well, if we want that patient to achieve their definition of success, then the first thing we need to do is we need the patient to stay long enough in order to actually deliver that success for the patient. So I'm assuming we've extracted from the subjective assessment how the patient defines value. That is the definition of success. These little dots are the milestones or the outcomes along the way that the patient wants to achieve that we've also extracted from the subjective assessment. I've talked a lot about that in a separate video called Patient Value Outcomes. Now, the first stage that we need the patient to go through if we want that patient to stay the course even when the pain eases and achieve their definition of success that consistently generates reviews, referrals and retains them for the future, is stage 1 is all about getting the patient to buy in to the treatment plan. So stage 1 is buy-in, okay? Now, what do we mean by buy-in? Well, we need the patient to buy in to you as the therapist or your therapist. We need the patient to buy into the treatment plan, and we need the patient to buy into themselves, because the 4 big objections that we're going to run into with a patient is money and time, which is really just a question of value. Is what this reward going to give me, is it worth my time and effort? They need to trust you as a therapist. So trust is another key objection that we have to overcome. And then we have to overcome self-trust. So how do we overcome self-trust of the patient? Does the patient believe that they can actually do this? And that's where, when we design the treatment plan needs to feel easy. And that's why bite-sized chunks of all we're doing with the patient in the first session is getting them from the first milestone to the second to third, and then we keep them progressing so that it feels easy to achieve their definition of success. So it's just all about breaking it down. So to get buy-in, to overcome the money, the time, the trust and the self-trust objections, we need to be able to, as clinicians, confidently make sense of the patient's symptoms. That is the first thing the clinician needs to do, because if you're not confident and you're not able to make sense of the symptoms, then your communication to the patient, you're probably going to display high tonality, because you're a little bit nervous, because you're essentially bullshitting the patient, excuse my French, because you don't understand what is causing the problem, okay? So we're not able to make sense of the symptoms, which means our buy-in for the patient has significantly dropped, because the patient isn't going to trust the clinician, okay? So the therapist's ability to take all their knowledge and organize it so that they can make sense of those vague symptoms is critical. That's the first step. Then we need to be able to confidently explain to the patient what's the problem, why did it happen, what's the plan, and how many sessions is it going to take? And that's why getting the patient or the clinician to make sense of the patient's symptoms is the first thing that needs to happen before we can do that. So we need to do all of those things. We need to explain the problem, solution and plan that's meaningful for the patient. These things are how the patient defines value, and we need to explain that plan in the context of all of these outcomes so that they're relevant for the patient. So they see the value, they can see that actually the reward, it's worth the time, their effort, and then we need to break down that treatment plan into small bite-sized chunks so that the patient believes that it's achievable, okay? And if you do that, then very often the trust of you as the therapist will be overcome as well, because a patient is going to trust a therapist with a plan far more than a therapist that just goes to session. The patient has no idea where they are in their plan or how close they are to their actual destination. So that's the first stage. The second stage, and again, this is all happening in session 1, okay? So this is your first session here. Now the second stage also happens in stage 1. And this is why the initial assessment is so important. And I'm going to call stage 2 as a fast start, okay? Now, what do I mean by fast start? Well, stage 2, the patient needs to feel the difference in the first session. Okay, now assuming we've passed stage 1 and the patient is bought into the treatment plan, okay, they understand how many sessions it's going to take, they're ready to get going. The next thing now is the treatment portion of the initial assessment, where the therapist's ability to treat the right tissue at the right time in order to influence these outcomes is critical. And that's where now our clinical reasoning becomes very important. Now, in the Go-To Clinic mentorship programs, we have the Go-To Clinic Hub. And in the Go-To Clinic Hub, we have a fast start section specifically for this. So if we have a knee pain patient coming in, we've got specific hands-on techniques and rehab techniques that we know is going to change your patient's pain experience. And we know that the common outcomes that most patients want to achieve throughout the week, there's simple cues we can do to redirect their load and change their pain experience. And that's very important to give them these things in the first session so that they can feel the difference in the first session. Because they can buy into the treatment plan, but if they don't feel any progress, then guess what happens? Self-doubt. Is this going to be worth my time and money? Objections come up again, okay? So that's where the ability to prescribe the right treatment techniques and the right rehab techniques in the first session so the patient can feel the difference that's meaningful to them in their outcomes is critical. And if we don't pass that, then we've really increased the risk of that patient dropping off. Now, stage 3 also happens in the first session and between that and session 2. So stage 3 of the patient journey is the patient rebooks after the IA, but they also turn up to the second session. Okay, and that's really important. It's all well and good. Anybody can rebook an appointment, but it's a lot harder for that person to actually rebook. Okay, now what can go wrong between session 1 and session 2? Stage 3 is all about prescribing the right rehab exercises to give the patient to take away so they maintain the progress they felt from stage 2 and they continue that progress in that week. Because again, think about it, the objections you're overcoming with your treatment plans is this worth my time, money, effort? Do I believe I myself, self-trust, can actually do this? And then do I actually trust you as a clinician? Okay, but the big objection is self-trust for the actual patient themselves. So the rehab that we give the patient for self-trust and to feel the difference on a daily basis, it must be easy to implement on their daily basis. And this is where a lot of clinicians go wrong in private practice, is we get the patient exercises that demands them to sit on the floor, takes a lot of motivation, a lot of time. The reality is most patients don't have time. They're busy in everyday life. So that's where stage 3 is all about finding out in the subjective assessment, what does the patient's day look like and where can we put rehab in to change their pain experience. And if we can change their pain experience specific to the outcomes that they have defined as valuable, then they can feel the progress between session 1 and session 2. And that's why, again, in the Go-To Clinic Hub, I've introduced the Fast Start section. So the Fast Start section in the Go-To Clinic Hub, it's all about passing stage 2 and stage 3. So your therapists know what are the outcomes your patient wants, and we can prescribe the right rehab to complement, ultimately, the skills that the patient needs to achieve those outcomes. And then we move on to stage 4 of the Go-To Clinic patient journey. So stage 4 states that the patient hits the first 3 milestones in 3 sessions, okay? 3M and 3S. So the patient hits their first 3 outcomes as a minimum in the first 3 sessions. Now, why is that important? Because if they're not hitting their first 3 outcomes that they've defined as valuable, that we've agreed in the treatment plan in stage 1, then the patient isn't feeling the progress. They're stagnating, okay? And these patients are at higher risk at dropping off. So having a 6-stage patient journey and having patient value outcomes, we now have a way to identify our at-risk patients, the patients that are at most at risk of dropping off. So rather than putting scripts in for our admin team to rebook patients who have cancer, we can be proactive and use our head physio tools and our in-service trainings to stop these patients actually from dropping off. And then what it also does is it allows us as clinicians to reevaluate if our treatment plan is effective at achieving these outcomes. Because if the patient is off track to hit stage 4, it's a built-in alarm system into your clinical system to identify my treatment techniques and my rehab at the moment is not effective at achieving this outcome. So I can either do what Einstein said and do the same thing over, which is the definition of insanity, expecting a different result, or I can change my strategy. Again, that's where the Go To Clinic Hub is so powerful, is it allows you or your clinicians to retain treatment autonomy, but if you're not on track for that outcome, it gives you all of the key anatomy that influences the biomechanics to achieve that outcome, so you can see which tissues you haven't considered and influence them with your treatment approach, or you can go and use the Go To Physio clinical system. And I've got all my hands-on techniques, my rehab techniques, that I use to optimize towards these outcomes. So there's no excuse to help the patient. So the stage 4 is the inbuilt alert system that if this patient hasn't hit the first 3 milestones, they are at the highest risk patients in our clinic of dropping off. And it allows us to change strategy before that they feel like they're stagnating. Okay? Then we get to stage 5. Stage 5 is all about, now, at this stage, if we've hit stage 4, then stage 4 and above, the patient's pain is easing quite considerably. Stage 5 is all about the patient progressing even when the pain eases, okay? So the pain now has eased, but the patient is progressing and they know that there's more progress to be made. So at this stage, patient's pretty much pain-free, but they know that they still haven't achieved this outcome and this outcome. And this storyboard that we use in the Go To Clinic system is going to do a lot of the heavy lifting to show the patient. But we also need to do specific actions in stage 5, where we need to actually not just show the patient there, but we need them to experience it so they can feel the difference left and right or whatever it is. And again, there's ways we can do that in our Go To Therapist clinical system that fuels, that is the profit engine behind every Go To clinic. So stage 5 is all about doing some key actions that when the patient's pain is eases, they know that there's more progress to be made and they can feel that there's more progress to be made. And then we keep the patient progressing through there. This is where the magic happens. Because this is where now you can add real value to the patient, where they go from being afraid and fearful of certain movements to, as Louis Gifford said, thoughtless, fearless movement. And that's where we need to achieve stage 6 if we want consistent reviews and referrals. And this is now essentially that the patient has achieved their definition of success that they asked us for in the first place, and they've been exposed to worst case scenarios, okay? So what are worst case scenarios? Well, where for this patient is the worst case scenario? What are the positions that they need to be in? And that could also be physical or non-physical stressors that could predispose them, again, to potentially this injury coming back. Because if we can get them to go into these positions that they're fearful, they come out the other side of it and they know they can do it now, we then discharge them with thoughtless, fearless movement. And that's a feeling. Customer experience is a feeling. They can feel the difference, because on the other side of fear is where everything good happens, okay? And that's the beauty of stage 6 now, is we've left them with a good feeling. Now, that's your 6 stages, and there's undeniable proof of where your patient has dropped off. So we can use these 6 stages as a key framework for our head physio systems to figure out where us or our clinicians are having patients drop off. What happened or what didn't happen is a better question at each stage, and we can instantly then rectify that and actually put the key inputs in that's going to lead to the outputs and improve the patient's ability to keep progressing through the stages. So if you want more information on the Go To Clinic patient journey and the 6-stage framework, the patient value outcomes and how we use these with our head physio dashboards, and we use these metrics to get mastery for clinicians to keep patients progressing all the way to stage 6. There'll be a link under this video where you can get more information. So we help private practice therapists who are working for someone else in private practice. We can help you. We can help solo clinic owners who work in your own clinic. We can help clinic owners who have multi-therapists and you want us to help you, or even just train your clinicians. We've got the systems, the processes, and all of those programs have access to the Go To Clinic Hub that does the heavy lifting for you to help your patients keep progressing even when the pain eases, but most importantly, to make a fast start so that the patient comes back after the first session. So wherever you are on your journey, click on the link below, let me know your situation, and then on the back of that I can see what the best program is to help you solve your particular issues and get you to where you want to get to a lot faster in the most simple and direct path.